We consciously and intentionally repurposed the Department of Medical Education into the Department of Learning Health Sciences. To our knowledge, this is the first in the nation. It has the classic emphases in research as well as in education. The service mission is what we're really here to talk about tonight. Choosing where to start the whole journey towards a learning health system is no small task. And the choice has been made to focus on diabetes. There's a number of reasons for that. Clearly, just based upon the backgrounds of all who are in this room tonight, diabetes touches the institution, the university, the community in many, many different places. And so it is not an entity that is confined to one clinic, one department, one school. For that reason, it's very appropriate to look at diabetes generally as a starting place really for the learning health system. But beyond that, diabetes is incredibly complex, and there's a tremendous amount that we don't know about the entity.
How does a learning health system work? Well, a learning health system works through the implementation of what we call virtuous cycles of study, learning, and improvement. But if we have a goal of interest and a community forms around that goal, the process, once a decision is taken to establish a virtuous cycle to achieve that goal, begins at 7 o'clock with the assembly of data about what we do now and what the consequences are of what we do now, what the results are of what we do now. And then moving around, those data are analyzed, the results are interpreted, and here the cycle breaks. You can see a discontinuity here because here there is always an intervention where the results are interpreted, their significance is ascertained, and their credibility is ascertained. And a decision is made about what we have learned and what feedback to people in a position to make a decision should be delivered. Then at 2 o'clock on the cycle, customized feedback is delivered to the decision makers based on what you currently do now and based on what we learned. This is what you should do differently or what we believe you should do differently. And then some action is taken. That advice may be followed in full, that advice may be followed not at all, and that advice may be followed partially. And after that action is taken, there is new experience as a result of changed practice, and that feeds into the next cycle of this continuing virtuous cycle, leading in most cases to continuous learning and improvement. Key to where we eventually want to go, very importantly, needs to be understood as not only including a number of learning cycles or establishing a number of learning cycles going on, but also creating a platform that sits underneath all of them, supports all of them, and makes them efficient. I've likened a platform to a laundromat. I mean, if you think about it with a sort of simple but I think compelling analogy, let's suppose you had to do 20 loads of wash in one day. Well, you could, if you wanted to, you could find 20 of your neighbors who had washing machines. You could make arrangements to get into their house, find out what kind of detergent their washing machine uses, find out when they're going to be home, get keys, and go to each of their 20 houses, and I guess you'd get your wash done that way. Or you could go to a laundromat, which is persistent infrastructure, which has been developed for the sole purpose of solving that kind of problem. So you can think analogically of a platform as a laundromat, supporting, in this case, and moving out of my analogy, learning cycles in a learning health system.
I think this is a great idea. I think it's a critical idea. This is not a magic system. It is what the culture, the intelligence, the problem solving, and the devotion to our missions makes of it. The diabetes community is probably a small enough community here for us to pull together and really be dedicated. And our primary missions are excellence in patient care, excellence in scholarship, and excellence in leadership in healthcare. both in our state and nationally. And this provides that opportunity.
If we can get diabetes right, I really think we can take on any disease here at the University of Michigan.
Yeah, they're all really important. And that's why I said, you know, as Chuck described in his comments, this is just to get something started. And then once you have this in place, hopefully we can take all of these on.